You know, we all have the ability to heal from infections pretty quickly, thanks to our amazing immune system. But what if the infection isn't visible, but already inside? Like when it comes to viruses, the beginning stage is always the most tricky part because we don't see the symptoms, but that doesn't mean they aren't there. Now, even though every single person is different and every single infection is unique, there are some common warning signs that something is up in your mouth. So I'm going to share with you 9 mouth symptoms that may be warning you of a hidden infection. Now, it's important to note this. The symptoms that I'm going to show you today, like smoke before a fire, are not the problem. They're just pointing to the real issue. So please do yourself a favor. If you notice any of these 9 symptoms that I'm about to share with you, go ahead and check yourself right away. Let's get into it. Number 1, you have a metallic or bitter taste without reason. Now, most of us have experienced that metallic or bitter taste in our mouth, especially when we brush our teeth. And many times it goes away very quickly. However, if you've noticed that you've been having a persistent metallic taste in your mouth for several days, weeks, or months, that could be a sign that you have an underlying infection. This type of taste occurs due to the immune response of your body to the infection. Also, if you've noticed that you have bad breath and it's not going away no matter how much you brush or use mouthwash, that could also be a sign of an infection. No. 2, you have foul breath that returns after brushing. Yeah, I'm going to talk about bad breath again. It's pretty common for someone to have bad breath after consuming certain foods like garlic or onions. However, if you've brushed your teeth and used mouthwash and you still have that bad breath or worse, the bad breath comes back after brushing, then that could be a huge red flag. Why? Because bacteria often causes bad breath and it can be a sign of an infection somewhere in your mouth. Note 3. You have an ulcer or sore that won't go away. So we've all had our fair share of ulcers or mouth sores, those little wounds that pop up inside our cheeks or on our lips. These normally disappear within a week or so. However, if you've tried everything you can think of to get rid of them and they just keep coming back, you might have an infection. Ulcers can be caused by a variety of factors like stress, nutritional deficiencies, or injury. But if they persist for more than 2 weeks, it's best to consult with your doctor. Ulcers that won't go away could be a sign of an underlying infection like mononucleosis, herpes, or syphilis. It's important to seek professional help to get a proper diagnosis and treatment. Don't try to be a hero and treat it yourself. Number 4, you have a yellowish or white coating on your tongue. Normally, our tongues should be nice and pink. However, if you've noticed that yours has a yellowish or white coating, that might be a cause for concern. This symptom could be a sign of an infection or inflammation in your mouth. It's important to note that a white coating on your tongue could be caused by a number of factors like poor oral hygiene, dehydration, or smoking. However, if it persists for more than a few days, it's important to see your dentist or doctor. The yellow or white coating might be hiding some nasty stuff going on underneath. So don't play around with it. Get it checked out. Number 5. You have sharp tooth pain when pressure is applied. When was the last time you had a filling? If it's been a while, it's possible that you might need another one. However, if the tooth is causing you sharp pain whenever you bite down on it or apply pressure to it, there could be something else going on. A toothache that gets worse with pressure could be a sign of an abscess tooth. An abscess is a pocket of pus that forms at the root of a tooth due to an infection. So, if you feel that throbbing pain, don't wait to call your dentist. Number 6. You have a puffy area near your gums. Our gums should be nice and firm, not puffy. If you've noticed that you have a puffy area on your gums, especially if it's red, swollen, or bleeding, that could be a sign of an infection. Gums become puffy when they're inflamed or infected. This condition, known as gingivitis, is usually caused by poor oral hygiene or an accumulation of plaque and tartar. If left untreated, gingivitis can develop into periodontitis, which can cause serious gum disease and even tooth loss. So if you notice any puffiness or redness, make sure to talk to your dentist. Number 7. You have a feeling of pressure in your jaw. Okay, this next symptom is a little bit more tricky because it can be caused by a lot of things. Some of you might experience a feeling of pressure in your jaw or around your ears, especially when you wake up in the morning. Now, this could be caused by a buildup of mucus or fluid in your sinuses. Or it could be caused by bruxism, which is a condition where you grind your teeth or clench your jaw during the day or while you're sleeping. But if you notice that this feeling of pressure in your jaw starts to persist and lasts for more than a few days, it might be a sign of an infection like osteomyelitis, which is an infection of the bone marrow. Again, it's important to get checked out if it doesn't go away. Number 8. You have red streaks or pus between your teeth. You know, it's normal to have some blood in your spit when you brush your teeth or floss. However, if you've noticed that you have a red streak or pus between your teeth, that could be a sign of something more serious like an infection. This symptom could be caused by a number of factors like gingivitis, periodontitis, or even an abscessed tooth. As I mentioned earlier, it's important to visit your dentist right away if you notice any signs of infection, because it can lead to more serious complications if left untreated. Remember, knowledge is power. The more you know about your body, the better you can take care of it. And number 9. You have a cut in your mouth that's slow to heal or is bleeding. Cuts in the mouth can happen to anyone. Whether you're biting your cheek by accident or have a mishap with hot or sharp food, these little accidents can leave small cuts in your mouth. Normally, these cuts heal within a few days. However, if you've noticed that a cut in your mouth is taking longer than expected to heal or is bleeding excessively, that could be a sign of an infection. If left untreated, an infection in the mouth can lead to more serious complications like tooth decay, abscesses, or even sepsis. So please remember, if you notice any of these 9 symptoms, do yourself a favor and check yourself. Infections rarely announce themselves. They spread quietly. But with a little awareness and self-care, you can catch them early and prevent them from getting worse. Stay healthy. Stay informed.